All right, I'm going to run through your movements. So to start with, you're going to lie on your back. You can use a pillow for your head if you need it, or a small cushion or something like that. I'm not, but so you're going to lie on your back with your knees bent. And we're going to start first of all with the pelvis, all right? So we'll use your pubic bone at the front of your pelvis as a reference point and your chin as a reference point, all right? But we'll start the movement with your pelvis. So this is just to get a bit of movement into your spine, a bit of articulation into the spine. So what we'll do first of all is let your pelvis tilt forwards, and what that creates is a little bit of extension in your lower back. So you're not jamming your back up towards the ceiling at all, right? You're not forcing your back up. You're allowing the pelvis to do the work for you. So you're letting your pelvis rock forwards really heavily, and we'll hold it there, and then let your pelvis rock backwards and let it rock forwards again. Now we're going to include the chin. So let your pelvis rock forwards and allow your chin to roll down. And then we're going to let your pelvis rock backwards and allow your chin to slide up. Now don't worry if it takes you a few goes to get the hang of this. All right, just keep with it. So rocking forwards with the chin and the pubic bone, rocking backwards with the pubic bone, the chin is lifting. So we'll stay here for a breath in. So I'm in a backwards position here, so breathe in. And we're going to rock forwards. And we'll stay here for a breath in again. And breathe out, rock backwards. Breathe in now to rock forwards. Blow out to rock backwards. We'll do 2 or 3 more, breathing in and blow out. And what we'll also do in the last couple is focus on your rib cage here at the front. So as you breathe out, the rib cage is dropping down. You'll notice that the chin will slide up a little bit more. Breathing in and breathing out and rocking backwards. Then you can just rest into your neutral spine. You can spend a bit longer in that movement if you want to. You can pause me and spend a little bit longer if you like. I'm going to move on now to some movements of your mid-spine. So you're going to have your knees together. If you want to pop a cushion between your knees, that's absolutely fine. Go ahead and do that. You're going to take your top hand, super glue it to your chest. So your sternum at the front of your chest, your rib cage. So you're going to roll back, and you can take your head with you as you roll back. And you're trying to actively pull the ribs around whilst keeping the knees super glued. So you're not letting the knees lift because that changes the positioning of your pelvis. Come on ahead forwards again. So breathe in. As you breathe out, go backwards. And you can stay here for a couple of breaths if you like. And come forwards again. Now, if you find you want to get a little bit more progressive with it, what you can do, as long as your shoulder is not grumpy, you can take your top hand and you can reach it back behind. And again, trying to keep your knees as close together as you can. I'm going to do 2 more here, and then I go to the other side. And again, you can do as many of these as you like. It's a really, really nice stretch, and it's really effective at mobilizing your mid-spine. And come forwards. I'm going to go to the other side. So again, you will need a cushion for your head, most likely for this. So I'm going to do a couple with my hands super glued to my chest. So you're rolling back and an out breath and come forwards. So it's always nice just to do a couple with the arm as a short lever first, and then you can progress on. So we're going to lift the arm. You're following your hand as you rotate it back, and you can come forwards again on an out breath. So breathing in. As you breathe out, rock back. And you can hold it there for a moment and come forwards. I'm going to do 2 more. So rocking back, rotating back. And come on ahead forwards. And once more back. And return home again forwards. Alrighty, so moving on now to your back. We're going to do a couple of abdominal curl ups. So with your hands, you're going to have them interlocked, and you're going to take that your 2 hands behind your head. All right, I'm going to just take that block away. Okay, so to start with, you're going to think of letting your head go really heavy, and on an out breath, you're curling up, and you're thinking of bringing your bottom ribs close towards your pelvis, all right? So try not to have your neck you don't want it to be grippy or anything like that, or any tension in your neck. So let your head go really heavy. Lower back down. It might take 1 or 2 goes to get the hang of this. Breathe in again, and as you breathe out, curl up. So your eyes are looking towards your thighs here, holding it for an in-breath, and lower back down on an out-breath. And again, curl. Holding it here, and then lower back down, and again, breathing in, and curl on an out-breath, and lower back down. Let's do 3 more. So curl, and lower back down, and 2 more, and return down, and 1, and lower back down. So we're going to include a leg now, all right? So as you curl up, you're going to bring 1 leg in, and then we're going to reach that leg long. Now, you might want to get yourself a stretchy belt and wrap it around your foot, okay? And then you can hold on to the belt here. I don't have one, I'm afraid, at the moment. We're going to lower your head down, and you're going to lower your leg down. So if we can pretend I have a belt or a stretchy band. So we're going to lower the leg and the head down. So the leg is supported obviously if you're using the band, all right? Breathing in here again and curling up on your out breath. So you're bringing your leg and your head closer towards each other. And then obviously if you're using the band, your leg is well supported. Lower back down, breathing in, breathing out, and curling up. So the leg doesn't necessarily have to be straight, but that's what you're working towards. So, you know, you can have your knee bent a little bit if it needs to be, but as you're lowering the leg down, try and reach the leg long. And again, we'll do 3 more here, curling up. So again, you can use the belt if needs be, and lower back down or the stretchy band. 2 more, curl, and lower back down, and again, lift, and lower back down. We'll switch sides. So again, the knee's going to come in and curl up. We're going to reach the leg long. So if you're using the band, you're going to hold the band in the same side as the leg you're working on, and just make sure that the elbow is resting down on the floor. So you need your band to be long. So lower both down, breathe in, and curl up on an out breath, and lower back down. We'll do 4 here, curl, and lower back down, and 3, and return down. 2 more, curl up, and lower, and 1 more, lift, and lower, all the way back down. Brilliant. Now, bit of sideline work again. So if you want to take your cushion or pillow, you can do that. Both knees are going to be bent. So you're going to have your knee and hip in line with each other, and you're going to lift your top knee. All right, knee and foot. So your goal is to try and keep your torso as stable as you can as you extend your leg as far back behind as you can without that bottom knee beginning to lift. We'll bend the knee back in again and press back. So you're taking your knee back as far as you can. And with each repetition, just see, can you go back just an extra tiny little bit, just to get a bit more range in that hip joint. So we're getting range in the hip joint first, and then what we'll do is we'll add the strengthening movement on top. So it's always nice to get the range first, and then that will get the muscles ready then to be strengthened. So again, just checking that the knee and the foot are in line, especially as you bring the leg back. We'll do 3 more here. So 3, and really pressing the knee back, and 2, and 1, and we'll return down. So knee and foot are coming down. This time we're going to keep the feet super glued together, and we're going to lift the top knee. So the top knee is going to lift, and again, we're not letting the bottom knee lift. Neither are we rolling back in our torso. So keeping the body really steady, lower the knee back down. So we'll pulse it a little bit. So we lift, and then lift a little bit higher, and lower back down. Lift, and lower back down. So you should feel it really working into the back of your hip, and lower back down. We'll do 4 more here, and lower. Breathe out as you lift, and down. We'll do 2 more. And lower, and you're getting your stability here as well. So you should feel a little bit of work on the obliques, on the sides of your waist. So it's important that you stay really steady. Now we'll go the other side. All right, so firstly, lifting your knee. So bending the knees up, lifting your knee and your foot. So lift, and then press back, extend back. So the first couple, you're not going to get a huge, you're not going to get a huge amount of range, but keep going with the range, and bit by bit, you'll get a little bit further with each repetition that you do. So press back and come forwards. And on an out breath again, press back and come forwards. And again, pressing back. So again, we're looking for the range in your hip joint itself. So we'll do another 4. And come forwards. And 3. So we're not going very speedily with this. 2. And 1. And let's lower that knee back down. Now we're going to keep the feet, should I say, super glued together. Lift your top knee, lift, and lower back down. And again, up, and lower down. And again, up, and lower down. Let's do 4 more here. And down, 3, and lower, 2, and down. 1 more, up, and lower back down. Brilliant stuff. Now, coming on to all 4s. So, you can definitely have your knees and hips in line with each other. You can have your hands a little bit more forwards if you want, all right? So what we'll do first of all is let the belly button lift up towards the ceiling, all right? So on an out breath, press your hips or your belly button up. You're tucking your tail under and you're pushing your hands down. And then we'll let the belly button tip down towards the mat, and think of your chest and ribs at the front lifting up. So we're getting a really nice extension through your back, your mid back. Belly button's going to lift again on an out breath. So curling up and really trying to tuck that tailbone under, and at the same time with your shoulder blades trying to let them part as much as possible. Let the belly button tip down. So we breathe in here and breathe out and lift. We'll do 1 more. Let the belly button tip down, lift your chest, and then curl up. So what we're going to do here is keep the curl, keep the shape in your body, and we're going to sit the hips halfway back. So you're going to feel that into your lower back, a stretch into your lower. Go back as far as you can feel the stretch. And hold it here for a moment. And now let the belly button tip down and travel forwards again. So belly button lifts and send your hips back. Let the belly button tip down and travel forwards once more. Belly button's going to lift and sit halfway back. And hold it for a moment and let the belly button tip down and travel forwards. And then you can finish. You can have your knees just slightly wider than they'd normally go, and you can sit your hips back towards your heels. So you're trying to make that connection as close as you can. First of all, obviously not compromising your knees. If your knees are a bit grumpy, you don't go fully back. But we'll try and get as much range here as we can. So bring your hips as close to your heels as you comfortably can. And from there, you're going to try and keep that distance and walk your hands out. So get the hips there first and then reach the hands out. And you can let your head rest down. And then when you're ready, you can come on up. You can stay there for as long as you like. Alrighty, so hope you get on okay with that. So that was really kind of targeting the abdominals and the hips, getting a bit more range into that.